from Kalamazoo, direct to you, it's a WKZO.com quickcast.
Thoroughly mystified by everything that's going on. It's happening fast, it's confusing. Healthcare is always confusing.
Right.
How do you simplify it?
Everybody in, nobody out. That's what single payer is about. Healthcare is a human right, and everybody should have access to healthcare. Our present system, to begin with, excludes 46 million people who have no health insurance at all. We have another 50 million people who have totally inadequate health insurance. And our system is unsustainable. We think that everyone in this country should have access to decent health care. And I think that if we don't change to a single-payer system or something similar to that, it's unsustainable. That our economic system cannot contain it, and there's too many people now who don't get the health care that they deserve.
Sounds expensive.
You know what? We already spend almost twice as much as any other country in the world in our health care. And other countries have longer life expectancies, less infant mortality, and a higher quality of health care for their people. The United Nations World Health Organization ranks us 33rd in the provision of health services to our people. It wouldn't be expensive. Right now, we spend about $356 billion a year on things that we don't get any health care at all for, such as billing, marketing, lobbying, contributions to congressional campaigns and presidential campaigns. If we took that money and put it into health care, we would have a high quality of health care for all our people.
Does everything to do it all with prevention versus...
Even if we get single-payer health care, we still have to emphasize prevention, because a right demands a responsibility. So people have to take care of themselves. But we have to make it possible for people to take care of themselves. We have to put money into education. I'm just talking to Jane here, who runs this free health clinic, and she's very big on that. We have to help people understand how they take care of themselves. We have to give them living wages so that they don't end up with diets that are going to lead to diabetes and other kinds of things. So with single-payer health care and health care for everybody, there is still an important personal responsibility and investment in prevention.
Well, prevention ties into it. If you're not seeing a doctor, you can't get the advice.
Exactly, right. Too many people. And the system is so crazy. I'll just tell you one story. I had a young kid in my class come up to me, undergraduate student, this past semester. And there was a whole bunch of students around, and she was crying. And I said, "What's up? Can I help you?" She said, "Can I just talk to you alone?" I said, "Sure." So we went up to my office and talked. She was diagnosed with cervical cancer. Her mother shifted her job and therefore shifted her health insurance. And they told her she would not be eligible for services for 6 months. She had cervical cancer. That kid needed to see a doctor right away. I brought her down. I talked to the people here at the free health clinic. They hooked us up with services. But if I wasn't there and somebody else wasn't there who knew how to hook that kid up, why should we do that to our people? It just doesn't make any sense.
Thanks, Don.
Thanks a lot, John.